So what is our role as a forensic toxicologist? Organizationally, we say we're here to provide quality analysis. And internally, we define quality as complete, accurate, and timely analysis. And we do our best to try to meet those goals. We're also there to provide interpretation of results for the forensic community and to testify effectively. As a training coordinator responsible for the training of young forensic scientists, this is often the most challenging aspect, is to get them to be able to testify effectively. So toxicology, as far as forensic toxicology is concerned, is different from clinical toxicology, although it's the same in some respects. It's different in a couple critical areas. We do use some of the same type of instruments that you might find in a hospital or a clinical type setting, but for forensic toxicology, you have a redundancy of testing. You almost always have to have, in order for us to place a drug or a metabolite on a report, it usually has gone through two types of testing using different chemical principles. And the reason that we do that is to exclude the possibility, to within a scientific degree of certainty, of false positives and or false negatives. False positive would be reporting a drug that's not present, or false negative would be not reporting a drug that is there. So why are we so slow? Well, we're slow because it takes time to essentially do things twice. So you can have two of those, but you can't have three of them, unless you got a lot of money. So our results in the form of report are set up with you as a user in mind. And we've got this second test philosophy. Two tests based on different chemical principle. What does that mean? It means it's two different types of instrumental analysis. If you were to simply repeat the same test on the same type of equipment, it's logical that you would get the same result. If you're using a different type of equipment that looks at the chemical in a different way, the probability of having a false positive is essentially zero. So that's why we do that two-test philosophy. And one of the tests has to be more sensitive and specific than the other.